Hospitals are sounding the alarm over a surge in flu patients overwhelming emergency rooms. The latest data from the Public Health Agency of Canada shows that nearly 28% of influenza tests are coming back positive. That is the largest positivity rate in Canada's last 3 flu seasons, the highest. For a closer look at what is happening, we are joined by Dr. Jesse Papenburg, pediatric infectious diseases specialist at Montreal Children's Hospital. Good morning to you.
Good morning.
So we know the Public Health Agency of Canada tracks where the flu is spreading across the country. So let's look at what they're finding. Southern British Columbia, most of Alberta, all of Saskatchewan, Toronto specifically, and southern Quebec, all seeing widespread flu activity. What are you seeing where you are?
Well, right now in Montreal, we are seeing a really rapid rise in the number of cases, particularly in school-age children. You mentioned the overall positivity rate across Canada was nearly 30%. In school-age children in Quebec, it's currently 70%. It is a sky high.
Did you say 70?
70.
Wow.
It is really, it indicates a tremendous amount of transmission in the community. And we often see that school-age kids are a bit ahead of the curve when it comes to the influenza epidemic. We see a lot of transmission in that age group, and then it shifts towards the rest of the population. So that's really what we're seeing this year, but it's remarkable to the extent at which this age group is being hit hard right now.
Can you give us a little bit of context? When you say 70% of this age group in particular, what did we normally see, like in the last couple of years?
I don't know that I've ever seen a value that high. Obviously, this is broken down into school-age kids 5 to 17, and it doesn't represent the whole population. In Quebec, we're around 35% positivity overall. So what we're seeing is it translates into a lot of emergency department visits in children. Our pediatric hospitals in Montreal are functioning above capacity, particularly in our emergency department. And also we're seeing a lot of hospitalizations and even critically ill children with influenza right now.
What are the symptoms of this strain of flu?
Well, the current strain causes an influenza-like illness like other flu strains. So the classic symptoms are an abrupt onset of fever, cough, sore throat, muscle aches, and fatigue. And that's what we're seeing a lot of right now, a lot of respiratory infections with influenza.
Today is Christmas Eve. Tomorrow is Christmas. Family and friends are gathering over the next little while. How concerned are you about the spread in terms of what we could potentially see in hospitals?
Well, as concerned as I am about the number of cases we're seeing in kids right now, I'm even more concerned about our elderly population. We know that the elderly year in, year out are the most vulnerable, 65 and above, to complications and hospitalization and even mortality due to influenza. But in particular, with the type of influenza that's circulating right now, which is influenza A, H3, and 2, we know that it hits the elderly even harder. So really, our most vulnerable population is at risk. I'm very concerned about that. And we know that during the holidays, there's a lot of intergenerational gatherings, opportunities for spread to this population. I think we need to be particularly careful about that.
When is peak flu season?
We only know after we've hit it. So we'll never know for sure exactly when it hits, but I'm expecting the peak season to occur pretty soon, probably just after New Year's.
You know, I've heard from some people, I've heard these conversations that, you know, we've been hearing that the flu vaccine is not a direct match this year to the flu strain that's going around. So a lot of people are going, well, I'm not going to get it because it's not going to be matching perfectly. There's no point. How closely matched is the flu shot normally?
Well, it varies from year to year. So we know that that translates into vaccine effectiveness that can vary from one season to the next. But on average, if you look at it over several seasons, we're talking about roughly 50% vaccine effectiveness. Now, 50% is not as good as we'd like it to be, but cutting your risk by half, especially if you're in an at-risk population, either because of age or underlying medical conditions, really is worthwhile. Now, for this particular strain, H3 and 2 does evolve faster than other influenza strains. And what we saw is that it did change between the time we had to make the choice for which H3 and 2 strain would go into the vaccine and now. And we don't know for sure how well it works in the field, but there are some preliminary data from the UK that do suggest that there is still quite a bit of vaccine effectiveness, probably 60 to 70% in kids 30 to 40% in adults they observed very early in their flu season. So whatever it is, it's not zero. And especially if you're in a high-risk population, it's absolutely worthwhile to get the shot, not only to protect yourself against the H3N2 strain that's circulating right now, but also against the other strains that can circulate later, either H1N1 or influenza B, which typically does have an epidemic outbreak after the influenza A season.
Dr. Jesse Papenburg, we do appreciate your time this morning. Thanks so much.
It's been my pleasure.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.